Namaskar, I'm Ashok. As you're watching Vision Asia Voice of the Community, this Sunday it is our special weekly edition, and as we all continue to experience the situation caused by coronavirus, and this pandemic has also caused extension of lockdown in New York, as announced by Governor this week. Now the date is extended up to 15th May. In today's special edition of Asia, we will catch up with some of the stories that we have already shared with you, and we will have a special meeting for ITV Gold with Council member Daniel Drom, who talks to us from Elmhurst, Queens. We'll also have pulmonary critical care and sleep medicine specialist from Harvard Medical School, Sahil Chopra, sharing his insight, as well as we'll have Dr. Priya Mukhopadhyay helping us to learn more about mental health awareness in this situation, and veteran Indian American journalist Rohit Vyas talks to us about COVID-19 impact and understanding the politics associated with it. We'll have a special segment with conversation from seniors, including cardiologist Dr. Virender Jutani, psychiatrist Dr. Nalini Jutani, and President of India Home Mukund Mehta will join us. Part of that segment, and also a very special weekly segment this week with Padma Shri Dr. Sudhir Parekh. Always waiting for you right after these short messages. While senior community is finding itself even in more restricted zone due to COVID-19 impact, everybody is homebound. Yet senior groups are also trying to find creative ways to make the most in these given circumstances. We talked to President of India Home Mukund Mehta, Dr. Virender Jutani, who is a cardiologist, and psychiatrist Dr. Nalini Jutani about how seniors are coping up with this situation. Here are some highlights of that conversation.
Elderly, particularly, are at more risk for just being an old. Anybody who is over the age of 65, 70, they are more vulnerable. Besides that, at any given time, if you look at the patient population, particularly in the elderly, most of them have more than 5-6 diagnoses, we say. Diabetes, high blood pressure, heart problem, lungs problem, kidney problem, arthritis, stomach problem, and the mental problems. That's my wife's territory. So all this problem cumulative adds as many risk factors, particularly related to this COVID-19 episode pandemic. Another thing what happens is just staying home, doing nothing else, leaves behind the chance of doing any kind of exercise, unless people are doing yoga at home or beating up each other. That's the only exercise that they have it at home.
I think that's a very good idea, and I won't recommend everybody to follow it. But if you beat each other, I mean, there's a lot of exercise, lot of exercise there. But what happens is people beat themselves more than they beat others, especially talking from the point of view of the way their mind play games, and we feel down when we are not in a position to do what we want to do. And I want to go to Nalini Jutani ji. In terms of, in general, some people are more motivated than others, and what is it that can be done for those who most of the time also feel little low, but now they feel that whole world has fallen? And in what way you can suggest some ways to see the positive as well as have a conviction that there is a light at the end of the tunnel?
So, Ashokji, we have to keep a balanced life and remember that this is a phase of our life that we have never seen before. However, a new journey has begun, and the initial phase of shock about what is happening, what will happen, and the fear that sets in leads us to becoming overwhelmed very quickly. And so, sadness, what will happen to me, my family, and so on, can lead to panic attacks, which is fear of something's going to happen. And what is that something is like everything that one does, a cough, a sneeze, is that going to be COVID? Is it now come in my house? So we have to learn now a new way of life, and that is what we will be doing, and we have been beginning to do with the help of other seniors, our families, as well as the technology, which is keeping us occupied doing things that we enjoy doing and keeping a nicely balanced life.
So, talking about balanced life, balanced thought process is also important. And as pointed out by Nalini ji, there are simple symptoms which causes alarming panic. If you are just sneezing, you can start thinking that will it lead to something so horrifying. And another thing, Mukundji, before I request you to share your impressions about how seniors are coping with it, uh, this is a very challenging situation in the sense that those who are in hospital, family members cannot visit them, and even once they pass away, it is not the normal funeral. So it is hard not to think about these sides. How personally you think a general reaction from seniors is heard, observed? Your take.
Ashok ji, seniors are really worried about what is going on nowadays, particularly when their family member or friends or relatives are in hospital. They cannot visit, and if somebody passes away, for example, in our own Indo-American senior citizen, where I'm a president, we lost 4 members in just last 2 weeks. We cannot attend the funeral. We cannot do anything more. Even their family say that they have to view the funeral ceremony and the final rites on televised method. So I think everything has gone topsy-turvy, and the social interaction is almost zero. And that is why we have to keep the seniors physically and mentally active. And we have initiated some program, mental programs, so that they can share their views as to some event or experience or episode when they first came to this country, and what was their reaction, something which was different from India, and it has an impact of a wow, what is going on here, and share their views. So we try to keep them mentally active that way. And later on, if you say, I'll say some anecdotes.
You're watching Vision of Asia, Voice of the Community program, and we begin with this special conversation with Council Member Daniel Drom, who represents District 25 that covers Elmhurst and Jackson Heights area. And as you are aware, there has been some stories coming from Elmhurst Hospital. It was mentioned by President also in his press conference, and a lot of attention is given to improving conditions at Elmhurst Hospital. Council member talked about Elmhurst Hospital also in his conversation for ITV Gold with Aditi Lamba.
In terms of Elmhurst Hospital, I have to ask you, since we have you here with us, it's made news nationwide. It is so badly hit. Could you perhaps give us a description of what's happening that you've seen on ground, and perhaps the development over the last few weeks, and what you are expecting for this week at least?
Sure. So the situation is bad. Every bed is taken, but they do seem to have a little bit better control over it right now than they did like a week and a half, 2 weeks ago. Elmhurst Hospital was short of PPE equipment, personal protection equipment, such as masks and other types of equipment to prevent them from getting disease, like gowns and things like that. Right. That supply now, I think, is beginning to come in, but here we are, a month into the situation, and they're just getting those supplies. So there's a great need for that. The workers at Elmhurst Hospital are working 12 to 14-hour shifts and sometimes longer. They're so exhausted that they can hardly even get back home and then get back to work again the next day. So we've begun to offer some hospital rooms to them, and that was the struggle for me to get the hospital rooms, not only for the workers that are there, but for those who might go back into overcrowded conditions in the housing where they're living. So there's a provision now where social workers at Elmhurst Hospital will be asking people before they leave the hospital, do you have a place where you can convalesce? Do you have a place where you can socially isolate? Social isolation for many of our folks is not possible. So Elmhurst was dealing with a whole host of issues. The lines outside Elmhurst originally were a block or two long. Now that has calmed down a little bit, and I think we're beginning to get on top of the situation. But it's still very difficult. We've learned of so many deaths. I just heard of the death last week of the president of the Bangladeshi Society, and that was a tragic loss to our community.
And Councilmember, when we're looking at these conditions of the hospital, lack of PPE, and obviously an increase in the number of deaths and the number of cases, what are some of your biggest concerns right now as a council member that's representing this really densely populated district full of immigrants? And what is the need of the hour right now for you and your team?
Well, prior to COVID, the federal government was looking at cutbacks to the health and hospital situation. Now, our immigrant communities depend on Elmhurst Hospital, and Medicaid cuts would really devastate Elmhurst Hospital. I'm hearing something like in the range of about $40 million in terms of cuts to that. In addition to that, New York State, Governor Cuomo asked, because of he's required to give a response to the federal government, about Medicaid cuts as well. We cannot afford any Medicaid or healthcare cuts to our community. This is the epicenter of the virus. If they take away healthcare, this virus will continue to spread, and it will continue to go out throughout the rest of the United States as well. So what happens here is going to affect what happens elsewhere. That's why we need to take care of our immigrant community here.
Definitely. And in terms of just looking at the apex that we keep on talking about, and the fact that we're reaching the peak of this coronavirus pandemic, your comments on how ready Elmhurst and Jackson Heights truly is as an area, both of the areas, how ready are they right now for that? And what is your personal agenda for the next 2 weeks as we are reaching this peak and then we are looking at flattening of that curve? I would like to know that insight into it. It'd be really great for our audience.
So as we move into the peak, or hopefully the plateau now, but still the peak nevertheless, my goals are really to get food to the immigrant community. I think that's really the biggest need that we have here now. But right. Looking forward to the future, I think that the issue is, how do we erase some of the disparities that we have seen here, that have become glaring now that we know that our communities lack healthcare, lack housing, those types of issues. So I think we must look forward. Now, New York City's budget, and I'm the chair of the Finance Committee, is looking at a $6 billion hit in revenue. We cannot afford a $6 billion hit. So just today, I got off of a phone conference with Senator Schumer, Senator Gillibrand, and members of the congressional delegation, including Alexandria Ocasio-Cortez, and we asked them to please push for revenue for New York City, because much of what we do in terms of our spending are those social service programs that provide a safety net for immigrants and for the lower income folks who live in a district like mine. So fighting that fight right now to get those federal dollars is my biggest concern as the chair of the Finance Committee.
Salil Chopra is a pulmonary specialist. Critical care and sleep medicine is his expertise, and he's associated with Harvard Medical School. A lot of us are finding ourselves in a position where we uh, cannot sleep because of the obvious special circumstances. But how important sleep is in order to retain the strength of our immunity. That and other areas of importance were touched by Dr. Sahil in this special conversation for ITV Gold.
This question is, how often do they need to clean their surfaces? So we're talking about, again, in the house where people are staying right now. How often do you think one needs to clean these surfaces? Because we are hearing the virus now stays on the surfaces.
Yeah, so if we look at some data from New England Journal of Medicine, they recently published an article a few weeks ago talking about how long the virus can be found on different surfaces. And what they concluded was that you can find this virus on copper surfaces for up to 4 hours, on plastic for cardboard for up to 24 hours, and plastic and stainless steel for up to 72 hours. So if we keep that, and then we also have other conflicting data stating that they found the virus in these cruise ships 17 days after when people had abandoned the ship, essentially. So I think this is very debatable. But if we think about this from the concept of being cautious, I think wiping down high-touch surfaces such as phones, keys, doorknobs, at least 2 or 3 times a day is probably a good idea, especially depending on how many people are coming in and out of the home. If you come home once and you're staying home and you've done everything from your end to remain hygienic and using soap and water and wearing masks when you went out, then you probably can wipe it down once. But if you have an individual who is going in and out of the house 2 or 3 times, they had to go to the grocery store, they had to go to the gas station, I think then in those situations, wiping things down more than 2 or 3 times may even be reasonable. So I think it really depends on every individual situation.
And Dr. Chopra, do we need to wear masks and gloves? A very popular question we ask every doctor here. Do you think when we're stepping outside, we're going to the groceries, we're going to pharmacy, or making these runs that everyone has to do normally here, do you recommend that they wear masks and gloves right now?
Yeah, a mask I think is definitely something mandatory, because you don't know if anyone's going to sneeze on you or cough on you, or if there's any aerosolized particles anywhere. The glove I think is maybe potentially debatable. It's probably not a bad idea, but you have to realize just because somebody's wearing gloves, but then you're using those hands that have gloves on them to touch your keys, touch your doorknob, you put those hands in your pocket, then it defeats the whole purpose of having a glove. So having a glove is reasonable if you're not touching your face, you're not touching your eyes, and you're still cleaning all the surfaces that the gloved hand touched. So it's reasonable, but I don't think it's necessarily mandatory.
Another question that we have here is, what are some of the symptoms to definitely watch out for COVID?
Yeah, no, that's a good question. If you look at the data, symptoms of fever, cough, whether it's dry or productive, and shortness of breath, these are the main symptoms that people usually present with. And I think those are the symptoms that everybody should be concerned about if they are having it. If someone is just having isolated cough, sore throat, or runny nose, or isolated body aches, I think it's something that you can just keep an eye on. Right. But if somebody's having high-grade fevers that's not getting better, they're having this worsening cough, they were shorter breath with 1 flight of stairs yesterday, and now they're shorter breath on walking on a flat surface, these are all symptoms that are pretty concerning.
Hmm. And like one last question from our audience, definitely we want to know, how often should one wash their hands? Because it's all about washing hands, it's all about maintaining a good hygiene. You know, that's something that we're stressing, but how often do you think we should really, honestly, according to you, wash our hands?
Yeah, again, it depends. You know, if you're staying home all day, you know, once or twice, whenever it was your whatever is your usual habitual routine of washing hands is probably reasonable.
Right.
But it's more important to make sure you wash your hands when you are going in and out of your so-called clean environment. If somebody's going to work and coming back, it's a good idea to wash your hands every time you touch something that you normally do not touch. So at least a few times a day is a good idea. But if you're home, then whatever your habitual routine of washing hands is, that is probably adequate.
You know, in terms of looking at high risk patients, and there are a lot of South Asian Americans that are at high risk with a lot of chronic lung diseases, heart diseases, cholesterol, blood pressure, diabetes, and also with your expertise in sleep medicine, and as well as the lungs itself, what are, you know, some of the concerns when it comes to patients that have these chronic conditions? And also, if they're watching you on ITV Gold, what are certain things you would recommend that they watch out for right now,
Yeah.
especially?
Yeah, no, especially if somebody has multiple comorbidities and their age is above 60, 65, it's best that they stay home and give the opportunity to the younger people in the family to help them out or do save up for them or whatever it is that that needs to get done. Specifically, if they have any underlying lung disease, COPD, uh, pulmonary fibrosis, asthma, if they have any congestive heart failure, if they've had stents put into their heart, if they have diabetes, if they have high cholesterol, if they've had strokes in the past. These are all, if they have chronic kidney disease,
Right.
these are all individuals that if they do end up getting sick, the chances of recovery are lower as compared, as well as the chance of them getting sicker is higher. So it's best for these individuals really to just stay home.
Right.
If they don't have an option and they have to leave their home, definitely wear a mask and wash your hands every time you touch something that you don't routinely touch.
Pandemic of coronavirus has impacted our lives in various ways, and one of the impact that is potentially seen already on mental health. The importance of having mental health awareness in the light of the impact that is likely to be caused by coronavirus pandemic. Dr. Priya Mukhopadhyay shared valuable ideas and insight. Take a look.
Most of our cases right now are somehow related to COVID, emotions as a result of the pandemic, trauma, like I mentioned, nightmares, loved ones, losing loved ones due to the pandemic, and more than anything, though, I'm talking with my coworkers. I think the influx of trauma and mental health cases after the pandemic, I guess, eases off is gonna be ridiculous. Like, we're expecting a huge influx of patients after all this is done, because you're kind of forced to stay at home, forced to deal with your feelings and the way that you deal with it. But once everything is open and you're able to come in, I feel like there's going to be an influx of patients.
So if someone is suffering from mental health illness right now, say they're in treatment or they're taking medication, what are certain factors that, according to you, that they should sort of look out for? And do you consider them at high risk, perhaps, during this pandemic?
It's a very difficult time. It's tough because a lot of people find their psychiatrists and their therapists as like the highlight of their month, the highlight of their week. It's a place for them to go. It's their safe place, and they're not able to have that. So I know a lot of people are struggling. And in terms of resources that are out there, I'd say to make use of everything that's there. Unfortunately, the help isn't as accessible as it used to be because of the lockdown. But a lot of people have had to make do with like self techniques and self relaxation activities. But I would say take advantage of your outpatient providers if you have one, as well as the crisis hotlines. If you feel like you need help, you need to talk to someone, you feel alone, don't be afraid to call and reach out. It's a phone call away. Our phones are working, thank God. So I would say make use of those resources. If you're on medications, do not ignore the fact that you're running out of medications. You are still able to get your medications, and if you don't feel safe going to the hospital, then you can call in and get those medications. We're doing assessments over the phone for people that are established patients or people that we can have some proof, and proof is easy to get. We call up the pharmacies, we call up their outpatient doctors. If you need a refill of medication and there is some proof, we'll give it to you. It's not, don't think it's impossible. People thought that this was impossible pre-pandemic, but we're making a lot of changes and tweaks just so that the things that are necessary are accessible to our mental health clientele.
Definitely. So that means there is patient care fully available for people that are seeking treatments or are currently involved, and they just need to basically contact them. In terms of living with mental illnesses right now, and then the family taking care of somebody or having someone around that you have to take care of, what are your comments in that sense? What should they be careful about perhaps right now while we're in the pandemic?
Right. So, like I said, stay on top of the medications. If you notice that your loved one or your family member is running out, make sure you touch base with them, see where they get their medications, if the pharmacy is open, if they have enough, ask the provider for maybe a month's supply with 2 refills, just so that you have enough. There's a kind of security knowing that you have your medications that are keeping you stable. So it's important to plan ahead and get that done with. Also, your family members will need you more during this time. It's inevitable. It's stressful for everyone. So especially if you're dealing with a mental illness, it's putting extra pressure on you, on top of having to deal with something that's chronic that you've already been having to deal with. So I would just say be an open ear. I know a lot of people are just like Netflixing and TikToking, which is totally fine, but involve someone else in the household in it. Make it a fun activity. Just engage everyone. It's really easy to just become a couch potato. But if you have someone living in the household with mental illness, just check up on them. Even if they seem fine. And this is for everyone, mental illness or not. Just check up on the people that you love. And if somebody you feel like is reaching for help, then always call 911. If you feel like someone's in crisis, if you feel like, oh, I'm not sure, but I think this person is a danger to themselves or others, but I'm not going to say anything, this is not the time. You call 911 and we'll assess the situation.
How are you feeling, and how is your team feeling right now? If I was to ask you what the medical community currently is thinking, what would you say?
Okay, so it's actually kind of turned our world upside down. Us in psychiatry, we usually don't touch our patients unless we're doing our medicine rotations. It kind of disrupts the patient doctor dynamic if we do kind of do like a full in detail physical exam. So we're all about talking. We're all about face to face. We're all about, get yourself down to the patient's level, make them feel comfortable. If somebody's dealing with something that's vulnerable, how are you gonna, just bring them down to your level. And that's been really difficult to deal with the COVID crisis, because we don't know, we're on the front lines, as in we're the psychiatric emergency room. People aren't being triaged before they come into us. So any person from the streets can come into our psychiatric emergency room without being screened first. So we are definitely dealing with people that are COVID positive, asymptomatic. We're dealing with people that are COVID positive, confirmed. We're dealing with transferred from different floors in our hospital that are COVID exposed. So, we've had to change our get-ups. We've had to change like the whole PPE. We've had to change how we do our interviews. We're no longer obviously staying next to the patients. We're staying 6 feet away. We're not wearing clinic clothes anymore, no professional gear anymore. We're just wearing scrubs just for the safety of us. Because, just as much as we're concerned about our patients, many of my coworkers have gotten sick. And PPE is hard to get. And, we're rationing. We're doing the best that we can. But a lot of people don't understand that even being in psychiatry, being a mental health professional, you're in constant contact with patients. Like I said, ours is the only field that hasn't slowed down. Well, we have the same issues that are dealing with. COVID isn't going to stop mental illness, So there's been a lot of changes. My coworkers and I are trying to keep morale up in the hospital. We try to crack jokes with each other, even in these difficult times, and we definitely protect ourselves with PPE, and we gear up, which is exhausting to put on, but I mean, I take that over getting sick.
The impact of COVID-19 pandemic is also felt in politics, be it national politics or international politics. How a leader of the country is handling the challenge caused by this pandemic is going to determine his future of his party also. And that is true for India as well as America. That is true for American relationship with China as well as China's relationship with the rest of the world. Veteran Indian American journalist Rohit Vyas talked to us about COVID-19 impact, and he helped us in understanding politics associated with it. Take a look.
Mr. Vyas, I want to discuss politics with you right now because with your expertise, understanding what politics has turned into during this global pandemic is, I think, very essential for our viewers. And to understand the roles and responsibility of states and as well as the federal government, I think that's also very essential. Your comments on what has happened on each level of the government and as well as what is going on in the entirety of the US politics right now.
Yeah, well, it's a lot of people don't understand the nature of the United States. It is the United States of America. So essentially, they're the states, and they are united under one federal law, such as foreign policy and generally the economy and certain things like that. So when the United States Constitution was written up, the states were given their individual mandates and powers.
Right.
The president, I'm putting it simplistically to try and explain to viewers. The president is the federal authority. He's the executive branch. He does have enormous powers and authorities. However, so do the governors of all the 50 states of the United States. They have complete authority. The same executive powers that the president has at the federal level, they have at the state level.
Right.
And therefore, the whole relationship is this. If a disaster has to be declared, which right now is in all 50 states for the first time in history, 50 states are under a disaster declaration of the federal government. So each of those states has the option to ask the federal government, the president of the United States, could you please declare a disaster in our state? Because that would open up federal funding to flow in. So usually the president would act at the instance of the governors. The president cannot act under the US Constitution at his whim and fancy and order states to do whatever the federal government wants it to do. In a national emergency, the president can strongly recommend that something has to be done. So for instance, it's, if you've seen some of these news briefings that have been taking place over the past few weeks,
right.
Reporters have pressed President Trump, why don't you declare a national lockdown, declare a lockdown for the whole country and, that type of thing. And he keeps saying that, I don't really want to do that because I can't do that. There are constitutional provisions, which means the states decide that. He can recommend, he can suggest that I suggest we have all 50 states go into a lockdown because this is the best way we figure we will prevent this pandemic from spreading further, and those who haven't got it, who have not suffered it yet, will not see it at all. So he can recommend it, but it is up to the states to decide. So the politics is simple. A lot of people don't understand it, but that's the way it works in the United States.
Another thing that I really want to discuss with you while I still have you on this interview,
yeah.
And, with your expertise again in politics so much, we saw Senator Bernie Sanders withdraw from his presidential race, making Joe Biden the nominee for the Democratic Party. And he will be going against President Donald Trump in November. How do you think we should look at these elections while we are dealing with this global pandemic in terms of priority and importance? And also, where is the South Asian American voice in this election, according to you?
Yeah, well, to answer the last question first, I think the South Asian American community is looking at this crisis first, just like everybody else is.
Right.
And I think people haven't yet decided anything yet. They were about to start to decide. Usually the decisions like that come after June, after all the primaries are over and things like that. Then you get into full earnest for the campaign. I think that's what's going to happen. At this stage, nobody is really focused on the elections. If you look at all the mainstream media here, by this time they would have started having debates and all the rest of it,
right.
On their shows. And discussing who was going to be who and doing what, etc., and whether it's going to be Trump or it's going to be Biden or Bernie Sanders. Now we know, of course, Joe Biden will be the expected nominee of the Democratic Party.
Right.
President Trump will be running again. But all of it now hinges on whether this virus is toned down at least somewhat so that elections can even be held. There's already debate about mailing in ballots versus going to the polling booths. That's heating up. So I think that's going to be an issue. But I think the Asian community, the South Asian community, the Indian American community, the mainstream American community right now is not focused on the elections at all. So that's going to be put on the back burner at least until June or July. And maybe then it'll be revved up if things calm down on this health crisis front. People will start to think about the elections and who the candidate should be and who can best handle the aftermath of what happens after this year.
Right.
Also bear in mind that we don't expect a vaccine to come for the next, I'd say about a year and 3 months now down the line, or a year and maybe 4 months. Usually it takes, as you've heard Anthony Fauci say, that takes about a year to a year and a half for an effective vaccine to come. So all that's going to happen next year. So the elections could go either way because people are going to then at that point weigh who do they think will be able to implement proper health care for the public in the future more effectively. Will it be Trump? Will it be Joe Biden? And that'll come up a little later in the year, that type of thinking before the elections.
Every conversation is somewhere related to the impact caused by COVID-19 these days and how WHO is being treated by United States administration in the light of its role, which is also being questioned in terms of its efficiency, integrity, and honesty by Trump administration. In this week with Padma Shri Dr. Sudhir Parekh, Dr. Parekh talks about it and also shares his views on extension of lockdown in India up to 3rd May. Let us begin, Dr. Sahab, first by welcoming you and thanking you for joining us. Namaste.
Namaskar.
And we go to India first with you and try to see as a physician as well as someone who is closely following all the developments of India, the extension of quarantine days up to 3rd May as announced by Prime Minister Narendra Modi ji. How do you look at that?
Well, I think it is absolutely necessary because right now we are in India, we are between phase 2 and phase 3. So till the phase 3 is over, quarantine has to be there. And I think what Prime Minister has done, it's really most critical and essential to do this kind of quarantine, to keep the number of cases down and number of sick patients down.
Continuing with the Indian condition so far in terms of the way different political leaders have responded to the need of the hour, how do you look at the kind of understanding which is being displayed, I think, by different political leaders from all the parties, more or less?
I think in this pandemic, it's a real crisis. It's a real emergency, and I can see that all the politicians, regardless of their thinking or regardless of their political disagreement for other issues, in this issue, I think everyone is together because this is a question of life and death of the thousands of people.
And there is a world body called World Health Organization. I think there was someone from WHO in India also who also talked highly about the preemptive measures initiated by Prime Minister Narendra Modi. But of late, there has been a lot of question marks about the overall effective working of WHO. How do you look at the role of WHO, especially in the context of this pandemic?
Well, I mean, WHO is a very important body of United Nations. WHO has done so many, WHO has tackled so many this kind of health crises, including Ebola and SARS and bird flu and so forth, and HIV infection crisis in 80s. And so WHO is very important, and I think WHO has some shortcoming, because in this particular pandemic, I think they were kind of little late for alerting the world. If they could have done little earlier and could not have a little glossified Chinese opaqueness, then I think the results throughout the world would be different.
But now at this hour, when we are in the middle of, we meaning as a world body, are in the middle of this pandemic, whether there are some shortcomings or not, do you see that restricting the support, financial support of $400 million to WHO by President Trump, it makes sense to you, or do you see differently?
No, it doesn't make sense at all. And I think Trump is incorrect or wrong, because in the middle of the pandemic, he should not have done this thing, because we need WHO. And whatever question or postmortem you want to do about who did what can be done once pandemic is over.
So I hear you, and there, in the press conferences conducted by President, one gets an impression that there is a sense of urgency in reopening America. But the timeline, can it be decided given the situation that we have? If we look at the number of human lives we have lost in New York itself, and there is no end in sight so far.
Well, the timeline or when to open, it all depends upon on the science, on the data, health data or scientific data. And right now, as of even as latest by this morning, Governor Cuomo is showing that the curve is flattening. Number of admissions to the hospital are less. Number of ICU admissions are less, and number of discharge from the hospital are more. And he showed the graph very nicely, and it looks like New York, New Jersey, tri-state area has plateaued, and slowly it will come down for the next couple of weeks. And that's how usually this kind of viral epidemic or pandemic behaves. And only thing is that most important thing is if at all, if you open the if you do the opening of the country, then because see every state has different impact of this virus, right? New York, New Jersey, tri-state has maximum, and then West Coast has maximum, then Detroit, Michigan, and Illinois has a lot, and Louisiana has a lot. But if you look at North Dakota, South Dakota, or Nebraska, there is not much impact. So only way to open up this thing is, while opening up has to be kind of rolling opening up. It means opening up with the only certain essential services, with the all guidelines in place, like social distancing, not together more than 5 people or 10 people. The restaurants and bars should be right now should not be open, just like what India did. All the sports arena or theaters, all should be closed. No wedding, no birthday party should be done. So no gathering more than 5 people, and continue to maintain the social distance. And when you go out in the public, everybody should wear the mask. That way you can minimize. And then the most critical thing is testing, isolation, tracing and isolation. It means we must continue doing testing, and those who are positive, you remove from the them from the circulation, trace their contact, test those contacts, and remove. And if they are positive, remove them from the circulation. So by doing that, definitely the rate of infection will go down. And because see, you cannot continue to completely lock down whole thing, including economy, because economy has to come back slowly. Otherwise, there will be a kind of depression and lots of then the effect will be much, because virus will go away. Of course, it will come back in the winter time. And I mean, real answer is to vaccine, but vaccine is almost 12 to 8 months away. So till then, we have to do certain phase, in step by step opening, with all the other guidance or guidelines should be in the place, and it should be strictly enforced. If there is a violation, then it should be punished, and that's only way to open the society. But I mean, good news is that the curve is flattening. Admissions are less, ICU admissions are less, and as you can see, that even Javid Center and that big Navy ship is still empty. It means they're hardly 20% used. That shows that it's a good news. I mean, and that shows that number of critical ill patients are getting less. And now, probably another week or two, you will see that number of new cases will be less. Still, there new cases are there. New cases in a sense that the one who are positive, more positive, because as you do more testing, you will get more positive cases. So if you keep doing another say million tests every day or every other day, or then of course out of that 10% or 15% may come positive. So you may think that is going up, but you have to see that whether cases are doubling every three days or every 8 days or every 10 days. As long as if it doubles every 10 days or 15 days, then the worry should be, scientifically speaking, the concern should be little less. But of course, you cannot open up as like nicely somebody said that like a switch of the light, that on and off. You cannot do that. You have to do phase wise, you stepwise, and you have to do only with the essential services. And then after essential services, after a week or two, then you can do little more and more and more, and that's how you have to keep going, because until some medication or treatment develops within the chances that treatment will develop within next 3 to 4 months, because like plasma therapy or some drugs. So if it does happen, because right now a lot of studies are going on in all the hospitals of the country where all the sick patients are there. So hopefully, if once we have treatment, and then later on once we have vaccine, everybody will feel more comfortable to go out in the society and try to come back to normal. But this normal will be different normal than what we are used to normal.
And now, time to say goodbye from this week's Vision of Asia Voice of the Community program. We will join you next week, but before that, we would like to remind you that stay safe, stay at home, observe social distance. If you need to move out of home for some essential work, don't forget to have mask and gloves with you. We wish good health for each and every one of you, with lots of good wishes, and once again reminding you to be friends of ITV Gold Facebook page, subscribe to our YouTube channel, and keep writing to us events@itvgold.com. Thanks for your continued support. This is Ashok Vyas. Namaskar.